Welcome, everybody.
Hi, everyone. Welcome. We
Happy
are so
November.
excited. I know. I can't believe we're here.
No, the crisp chill, it's in the air, Erin.
It is in
The
the air.
holiday season is in the air. I can feel it.
I know. I talked with a member today that said she was shoveling out snow. So
Oh,
at
stop.
least that's not us. I know. I
Not
know.
quite. Yeah.
Not quite, not yet. But yeah, we're happy to be here. And I'm happy to be hosting this topic along with you. I was saying before we got going that this topic was a suggestion from our survey from one of our
Yeah.
attendees that really wanted a discussion about life after treatment. So I am really excited to be here and sharing all of this with you. So it's going to be a great discussion. Get your questions ready.
Agree 100%. The beauty of this series too is that Unite for Her offers so many professional advisors, the ones that are going to be on tonight, all give access to like the integrative care that's a part of your passport or the Empowered Living program or the workshops. And it is really all these things that we take into our right life after cancer. It's just sort of starting to rethink how we're going to utilize those services or those resources or those experts. So tonight we get a chance to hear from them, how to transition a little bit easier. And of course, we're always here for you, our community. So it goes beyond just tonight, right? You can always access us at any time and use your passport or your Empower Living program at any time as well to dive deeper into some of the resources you're going to hear about tonight.
Absolutely. And I know that this is a discussion and this sort of life after is oftentimes members will say they feel sort of lost navigating this space and how to move forward. So we've got three fantastic experts this evening that will share some insight and give you steps. And we'll also be sending you a little takeaway so that you can reflect on what we discussed tonight. So as you move forward, you have some guidance to take with you. So a lot to leave once we wrap up our segment, but so excited to get started.
Yeah, I will say we have our A team here. These are a lot of our presenters that we have at our in-person wellness orientations, at our Thrive event, our Exhale event. So it's just so good to see everybody on with us tonight.
Absolutely. And we could not continue to bring our A team and these amazing discussions without the help of our sponsors. So, first, I want to make sure we thank our education sponsors. So, tonight's virtual hangout is presented through UFH Connect by West, Merck, Lilly, Novartis, and Gilead Sciences. We have additional support from our gold sponsors, Pfizer, GSK, and Daiichi Sankyo, with additional support from AbbVie, Tercera Therapeutics, and Veristem Oncology. So, they are our cheerleaders to continue to bring these really important topics, discussions, and incredible experts to you. And we are so grateful for their ongoing support.
Absolutely. This is how we get to serve not only this community here, but bring education to now 10,000 strong. We are serving over 10,600 members, and that's a lift for us. So we think of every way possible that we can bring the best of the best in these topic areas, and to see our pharma companies seeing the value that Unite for Her brings just is so impactful for us, for our community, and for our growth that continues
Yep.
on. Yeah.
Absolutely. So, for tonight, we will be hearing from our experts one by one. We'll get into reading a little bit about their bios, and then we'll have discussion and time for questions at the end. So, I encourage you to write down those questions you have as each of our speakers moves through their presentations, because we're looking forward to some really great discussion towards the end. But before we get to that, we have a lot more segments coming to you in the month of November. So, tomorrow night, we have our speaker series. Thursday, November 13th, 6 p.m. Eastern Time. I will be joined by our beauty advisor, Jolene Hart, and she is bringing with us makeup and beauty expert, Rebecca Cashano, and they are talking about confident and radiant everyday makeup for feeling your best. So, Rebecca is truly incredible. She's very well versed in working in the oncology space, and she'll be teaching all of us how to create a really natural, beautiful look that just makes us feel confident and ready to take on the day. And then next week, we've got two education segments. We've got a speaker series on Tuesday, November 18th, 6 p.m., demystifying clinical trials and really leaning into how we as a community and patients can play a role in informing and educating about clinical trials that are available to the community. So we've got a great panel discussion for that. Plus, we have our virtual hangout with our dietitian team. So, this is our Cooking 101 set the holiday table. So, if you are getting ready for Thanksgiving, join us next Wednesday, November 19th at 6 p.m. Myself and the rest of our incredible dietitian team are setting your holiday table. So, we are each taking a course and we are preparing 4 delicious dishes. All will be available on the blog. So, please join us. You can sign up for all of our segments and learn more about them at uniteforher.org/UFH Connect.
I know. I'm looking forward to that. I get to be your sous chef again, Erin.
Oh, I can't wait. I can't wait. It's so fun.
Yeah, and that speaker series is at 6 o'clock. So someone in the chat was asking about the makeup, everyday makeup. That's at 6 o'clock
Yeah,
Eastern time.
absolutely. Yeah, perfect.
Yeah, wonderful.
All right.
All right.
Should we introduce our speakers just to
Love
give
it.
everyone a lay of the land of who
Absolutely.
will be joining us
Yeah,
tonight?
yeah, very good. Well, how about if we start with Kevin? So Kevin
Perfect.
Hubert, yes, he has actually been with Unite for Her for quite a long time now, which I'm really grateful for because we get to utilize him here in the Philadelphia area. He comes in person to speak. He's a licensed professional counselor in both Pennsylvania and New Jersey, and he attended Temple University for both his bachelor's degree in psychology as well as his master's degree in counseling psychology. Kevin has made it his career to work in the community of color that suffer so many injustices, including but not limited to the access to quality mental and behavioral health. So we are so grateful that Kevin utilizes his skill set. He brings us a different form of therapy too, an ecotherapy approach. Incredibly grateful to Kevin for bringing that to our community. I find so much peace in ecotherapy as well, but he also is very versed in EMDR, mindfulness, as well as cognitive behavior therapy solutions. So, Kevin, thank you for joining us. I'm really grateful that you are here.
Perfect. We'll
Hey,
also be joined this evening by Priscilla Fitzpatrick. We'll do a little bit of intro before we lay the land. But
Mhm.
some of you may know Priscilla. She's the founder of Stronger Through Cancer. She's also a cancer survivor and turned her experience into a passion for health and wellness, earning her yoga teacher certification and later becoming certified in group exercise and cancer fitness. At a local YMCA, she led the Live Strong program for more than 6 years before launching Stronger Through Cancer during COVID. This is an online exercise and wellness community designed specifically for people affected by cancer. Priscilla is also a cancer exercise specialist certified by the American Council on Exercise.
Wonderful. And next we have Dr. Sabitha Pilia Friedman. Sabitha has been with us for, I want to say, 15 years. It's been a long time. She's right from the beginning. I remember her coming to those wellness days right over there at Terrain, right in Glen Mills. And she is a relationship and sex therapist at Rittenhouse Relationship and Sexual Health, plus has served as a sexual health consultant and provider for Unite for Her 2015. So how good did I do? I did pretty good. 10 years. Yeah. She is an
Yep.
ASEC certified sex therapist as well as an ASEC certified approved supervisor. She works with individuals and couples in her private practice in Philadelphia. And Dr. Friedman has more than 25 years of experience in providing individual, couple, and sex therapy and presents both nationally and internationally on wide-ranging topics related to relationships and sexuality. So please join me in welcoming all of our guests tonight. Thank you all for being here.
Amazing. So, why don't we start, Kevin? Why don't we bring you on to have you get started in our panel discussion this evening? So, we'll let you get started.
all right. Well, good evening, everyone. It's always good to just get on these different talks, and it just look. By no means, I sometimes say like I'm not like a subject matter expert. I just share what I know. That's all. But I'm delighted to be here to share the importance of mental health and emotional well-being after you've been through a battle like cancer. So I have 3 things I want to share. And I want to kind of quickly emphasize these points in order to kind of like push for a little bit more understanding in what therapy is and what it isn't. I think oftentimes when people think of therapy, they have this they have this schema in their mind where they're going into a therapist's office and they're sitting on a couch and they're crying for 50 minutes at a time. And sometimes that's what it is. However, that's kind of what we learn from TV. It can oftentimes be an experience unlike what we can experience outside in our quote unquote regular life. But I do want to kind of point to something that Sue said, which is about ecotherapy, and I want to talk a little bit about what that is and how that kind of contributes to my practice and how I utilize nature essentially to help treat people who are coming in for different mental health or mental illness ailments. Um, as an ecotherapist and also as a mindfulness practitioner, sometimes I have to kind of explain it a little bit, and I have to talk about like why I do this form of therapy. I say in the beginning, I do this form of therapy because it was something that helped me first. So I figure if it's something that was helpful for me, I'm going to share it with as many people as I can possibly share it with. And I know that on your healing journey, ecotherapy might be something that fits. It is essentially the act of doing therapy in an outdoor environment. Oftentimes, where my office is located in Philadelphia, I am literally in the middle of the Wissahickon Valley Park, inside of a historic landmark, and there are hiking trails right behind my office that I utilize with my clients. And that gives me a little bit of a privilege to be able to do that kind of work, because more often than not, when you go to see your therapist, you're in an office, you're on a couch, you're under fluorescent lights or whatever the case may be. But it is so important to be engaged in different kinds of practices. Sometimes it's not a fit if you're just saying, oh, I want to just go to an office. Sometimes it's like, okay, let me try something else that might be helpful for me. So it's always good to explore the different forms of therapy. So for many of us, it may be difficult, it may be traumatic, it may be anxiety provoking, it may be even just depressing to kind of go through something as difficult as cancer. And I know that there's a heavy pain associated, not just on a physical level, but on a mental and emotional level. So in doing ecotherapy, it is so important to me to make sure that people are able to do this form of therapy, number one, safely, and then to also be able to engage in it in different ways, not necessarily with the therapist present, but also in ways that they can do right at home. I'm a big proponent of people who have gardens and want to kind of maintain those gardens even through the fall and winter months, and it's so important to be able to do that because we all know that being around nature, being around plant life more specifically, it actually helps to generate what's called NK cells. And if you've been through cancer, and maybe your doctors haven't talked to you about this, but whenever we're around certain kinds of plant life, it helps to generate NK cells, which stands for natural killer cells. And I always talk about the benefits of being in nature, and I always bring up these natural killer cells because when we get those fighting sides off of plant life, we tend to inhale them, and then it kind of starts to help us to generate more of them over a period of time. So it's so important to get outside, to be in nature, and I definitely want to push for that. Yes, the weather is getting cold. I'm very much aware of that, but there is no such thing as bad weather, only inappropriate clothes. Okay. So another point I want to make is just to say, um, after, cancer, it's so important to be able to speak about your experience. And sometimes in the midst of the process, it may feel like you're simply just being, pulled in like every which direction. And it's hard, right? You might feel fragmented. You might just want to try to make sense of the experience itself. But this has been a journey, right? And you're trying to figure out, okay, well, what's the next thing? What's the next leg of this journey? Like, I'm not done and I want to keep going. So in therapy, it's important to tell the therapist what you hope to get out of therapy. And if that person that you're working with doesn't meet your expectations, you have every right and every ability to speak up and say, hey, I think I want to meet with a different kind of therapist. And it's no skin off their back. They're not going to be like, oh, well, forget about it. That it is about finding the best fit so that you have the best outcome, right? Just like with finding the right doctor so that you can get the right treatment, right? And so lastly, my third point, I just want you to kind of hear me out here, because I think a lot of people, when we talk about being patient, right? it's like, okay, well, how long do I have to wait? Of course, we live in a society where everything is go, 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 run, 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 fast, 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 right? But it's so important to be patient with yourself. One word that I use a lot when I'm doing therapy is compassion, right? More specifically, self compassion. We all kind of know what self care is. We know kind of like with self care, you're taking care of yourself, you're getting proper sleep, proper nutrition, you're being engaged in the wellness program with Unite for Her, all the things, right? But self compassion is a little different. Self compassion is actually the thoughts and the beliefs that you have about yourself towards yourself, right? So you've got to take that time to kind of disrupt some of those negative narratives that might have been formed throughout treatment. What if it doesn't work? Why don't I feel better? What will this cancer stay, out of my body, or will I stay in remission, or will it come back? All these questions, right? But I can tell you that stress is not something that you want to invite into your life after you've been through something so challenging. But you have to remember patience is your friend. So you will regain your footing. You will be able to get through that next step, but you have to be able to go through that, build your confidence, and you want to be able to continue that healing journey. So just to hit those 3 points again, make sure you spend some time outside as much as possible, prioritize what you need in therapy, and also make sure that you utilize and tap into that patience, because patience is your friend when you are engaging in mental and emotional therapy. All right. Thank you.
Amazing. I love the call out, Kevin, of just having some self compassion, and you're right, Lisa. Great reminders. I think so many, we get lost in the day to day and the stress of all of that, and compassion goes right out the window. So they're really great. They're really great tips. Thank you for that. All right, let's bring on our friend Priscilla from Stronger Through Cancer. Thank you so much for being here and sharing your night with us.
So happy to be here, Aaron and Sue and everybody. Thank you. And Kevin, I love what you said about something that worked for you, because that's a perfect segue for me. I also love what you said about weather, because I don't know if you're aware of that, but that's a Swedish expression that there's no bad weather, only bad clothing. So hi, everybody. Yes, I'm Priscilla. I'm the founder of Stronger Through Cancer. And Aaron gave me a beautiful introduction, so I'll just jump right in. I'm going to give you 3 points, and I want you to write them down. So the first thing is you need to schedule your exercise. I have 3 S's that I give my members. These are the 3 S's that I live by. So schedule your exercise, just like you have to schedule those infernal doctor's appointments, lab works, recovery, surgeries, everything, right? Look at your week ahead. You know what it's like. Put on your calendar, physically on your calendar, when you can work out. I wake up every day and think, okay, when can I work out today? So schedule your exercise. That's the first S. The second S is you've got to set up a space. If you are not going to go to a designated place like a gym, or you're not going to join, a program or go somewhere for this, you're going to be doing this at home, you need to set up a specific space. And it does not have to be a room. It doesn't have to be like a big workout area. I literally keep weights in specific spots in my house so that they're visual reminders. And honestly, I actually am not a huge proponent of feeling like I have to have a home gym. I would love one, but I don't have a big enough house. I want visual cues throughout my house to remind me to do something physical. So I will have weights in one area, I will have bands in another area. I also am a big proponent of creating like little motivational sayings and things for myself. When I used to work at the Y, I was in charge of the whiteboard, where you would put something every day, like you didn't come this far just to come this far. So I do that for myself. I have little post-its throughout my house. Because you want to be your own hype person if you're not going to, classes or a gym. So that's the second thing. To repeat, schedule your exercise, set up a space. The third, and the one that I'm going to talk the most about, is strength training. It's undeniable now. You can Google search this as soon as I finish talking. There are connections between muscle mass and predictors when it comes to cancer, particularly breast cancer, colon cancer, prostate cancer. The jury is still out on other cancers, but those are undeniable. And the reason for that is it's highly scientific. I'm not a science person, but I'm going to do my best. Our body has proteins, they're called cytokines. And one of those cytokines is a myokine, and they are released whenever you contract skeletal muscle. Okay. Why they're important is because they change us on a cellular level. They literally change us on a cellular level. They change the way our cells respond to interrupt, to disease, to stress. And they are now saying more than ever that there is a link between having more body muscle mass and how you handle cancer and treatments and recurrence of cancer. So we want to be strength training, ladies and maybe gentlemen. Walking is great. Swimming is amazing. Dancing is amazing. Yoga is amazing. I will never not do those things, right? But strength train, strength train, strength train. And if you don't know what you're doing or how to do it, you need to find somebody that can help you and specifically work with you, especially someone that knows how to work with someone who has or has had cancer, because you don't want to injure yourself. You don't want to think, oh, strength training must mean I have to use equipment, and you get yourself in a situation where maybe you can't replicate that at home because you don't have the equipment. You can just have a couple of heavy things around to lift. You don't even really need weights when you first start out. I know I have a couple members on here, but they can attest to this. I have a member who is a pastor who for years used Bibles. Okay. And then she progressed to like filled bottles of water. You don't have to have weights. You just have to be lifting something heavier than your own body weight. And you can start out by lifting your body weight, but you want to gradually increase. And you will as you get stronger. It's just going to happen. So those are my 3 S's. I hope you'll remember them, but I'm going to repeat them again. Schedule your exercise, set up a designated space, and strength train. All right. There were a couple of things that I thought of just today, and I really want to bring them up. And one is from my perspective, and then one is from the perspective of the many, many people I worked with when I was leading Livestrong. So, and maybe this will resonate with some of you. When I was sort of cleared for during cancer at the 4-year mark to prolong my appointment times, to prolong my lab times, right? I graduated to that. We won't need to see you for like 6 months. And I walked out the door simultaneously excited and horrified because I thought, well, what if something changes and they won't know because they're not watching me and they're not doing my lab work as regularly. So I went into kind of a full-blown panic of like, what now? And that what now to me was almost scarier than having regular appointments, because at least with regular appointments, I knew somebody was watching me. I knew somebody was able to like say, hey, your blood work didn't look so good this week. Like, let's, right? Yes, a lot of people are getting that. So the what now piece can be very, very scary. And if you're feeling that because you're kind of at that stage in your diagnosis where you're like, oh, what now? I can't stress enough how important it is to be around other cancer survivors and cancer thrivers because they get it. And you can share those fears, which are all very real. And hopefully in sharing it, you're kind of cutting it in half each time you share it, right? And then the other is from a perspective of the many people that I used to work with. And I don't want to down Livestrong at all. I think it's an amazing program, but it is a 12-week program. So if you're familiar with that at Local Wise, it's a wonderful program to kind of launch you, right? And I believe the parameters are still within a year of diagnosis. But what invariably happens is at the end of the 12 weeks, people were like, well, what now? And that what now for me was such a visceral reminder. I was like, oh my gosh, I remember that feeling of like, what now? Oh boy, what can we do for these people? And why I bring that up is because this needs to be regular. And if you don't think that it's going to be regular with just yourself as your person, as your hype person, as your coach, as your motivational, you've got to find somebody that's going to do that for you. After working in gyms for years, I can tell you the number one predictor for people to return to the gym is connection. Whether they get connected to their instructors or a personal trainer or other members or the staff, that's what causes recidivism. So if you are a person that knows you're going to struggle with trying to be your own motivator, you've got to find people. And I want you to remember that, maybe even more than the three S's, because I was pretty good at self-motivating. I mean, I have always liked to exercise. So I was kind of an easy get, right? I wanted to feel better. I knew that maybe I was too tired to work out, but I knew I'd feel better if I worked out. Not everybody feels that way. I get it. And so you need somebody to kind of go, hey, come on, you're going to feel better. You're going to feel better. You're going to feel better. Let's do it. Let's just do it. So if you know that about yourself, find a community, find somebody that can work with you, that will motivate you, that will coach you, and it might just be the thing that turns you on, and eventually you don't need them as much. But if you think that's going to be the difference between you not doing this and doing this, find someone, okay? Because you definitely want to make this a part of your regular life. It doesn't mean you have to work out every day. It doesn't mean you have to work out for an hour every day. It just means it needs to be regular and routine. Regular and routine. Okay? All right. Thank you. I'm so happy to be here, and I'll answer any questions at the end. Thank you.
Thank you, Priscilla. So much value there. I hear regular, routine, schedule, find a buddy, right? All of those things just resonate. And I can attest to that whole, reshifting your mindset that you don't have to lift heavy weights. You don't have to work out for an hour. You just have to be consistent.
Yeah.
You just have to be consistent. And being 21 years out, it took some time. I must admit, it took some time for me to find being consistent, but now I am and just loving it. Just
Yeah.
loving it. Yeah.
Awesome.
Yeah. Thank you.
Amazing. Thank you.
You're welcome.
And I will say, Priscilla, quickly, before we hop over, I love the reminder, the visual reminders that you say to place things around. We do that a lot with nutrition as well. If you want to eat healthier or have healthier snacks, put stuff out on the counters, have things right in front of you in the refrigerator, because when we see them, we're more likely to grab them. So I love that you're applying that to movement and exercise as well.
Yeah, that's awesome.
Yeah,
Perfect.
wonderful. Thank you.
All right. Next up, Sabitha. Hi.
Hello.
Amazing.
How are you?
I am doing well. So I was very intrigued that the previous speaker spoke about things that I speak about constantly as well. One of them being self-compassion. I constantly speak to the women I work with and men I work with about self-compassion because, in cancer treatment, there's a lot of self-loathing that happens because our bodies change and we don't look the way we do. After treatment. As a cancer survivor, I can speak as a cancer survivor, also as a sex therapist. There is a lot of body dysmorphia that happens, feeling that we are not good enough, our body's not good enough. So I frequently speak to people about self-compassion. So Kevin, I really am appreciative of your work in the area of self-compassion. This overlapping is really good for our, survivors who are here. And Priscilla, scheduling, there's nothing better than scheduling sex. How often do I have to tell people? Because everybody thinks it has to be like a Hollywood movie that you just are suddenly, spinning the wheel and your partner just comes from behind and seduces you. I'm talking about Ghost, of course. Sometimes it may happen that that sort of fantasy scene may play out in our lives, but most of the times it doesn't happen. If you have children and dogs and work, you really have to schedule. And you also have to, I do like the idea of kind of placing, kind of creating a physical space that is conducive to sex. So I often tell people remove all plastic objects like the swings and the toys, squeaky toys and things. Make your bedroom conducive to sex. So I think we have had several overlapping themes here, and I'm very excited about that. So, sex is a very fraught subject for people because, people think that sex is penile vaginal sex. So, that they think that's the gold standard. So when you make penile vaginal sex a gold standard and you're going through life transitions, such as, childbirth, aging, cancer diagnosis, any other illness and diagnosis, when your body is not there, that is not what we can do at that point. Does it mean we cannot be sexual in other ways? I urge people to think of sex beyond the penile vaginal sex and think of it, give it a broader interpretation. There are many ways to be sexual and sensual. We just have to, kind of stay connected to our partners through other means, through touch, sensuality, communication, even some sort of kinky activities like blindfolding, caressing each other. Those sorts of activities can also be part of sex. So when we are ready, you can do whatever you want, but do not limit yourself to penile vaginal sex, and do not, set a standard. This is the only thing that is sex. Everything else is not sex. Because most of the times I ask people, what is sex? What do you define as sex? Immediately it's penile vaginal sex. They don't think of anything else. So one of my big tips is to think beyond what you think is obvious explanation what sex is, and think about other sensual sexual activities that can be a lot of fun, playful, and could also bring about a strong connection with your partner. So that's my one tip. And another tip is, when our bodies change and we don't feel sensation in certain parts of our bodies, which is something we all experience during treatment. Surgery causes numbness of certain parts of our body. Radiation, causes, some sort of burn, sometimes lack of sensation, as do chemotherapy, So sexual side effects are very much a part of cancer treatment, and you all know that. So it is very important to think of our brain as the biggest sex organ. The one thing that never changes is how we feel about sex, because it is in our heads, in our minds, in our brain. So our brain is our biggest sex organ. So we can actually fantasize about the way things were, what can we do, what can we not do. We can fantasize about situations that were very erotic. So we can really supercharge our own desires with our brain, even though our bodies may not feel the same. So that is my second tip. By the way, the tips that I'm giving now are part of a larger presentation that I did. It was a video interview that I did with Sue. There are two presentations from the video library that you can go and look at, because it has a longer presentation about how to be sexual after cancer treatment. The third tip that I'm about to give you is sexual communication. Most of the times, people are afraid to tell their partner what feels good and what doesn't feel good. So I've worked with couples for 25 years. I've been a therapist for many, many years. I've worked with couples who have been married for 25 years. And one day the female partner told me, he keeps rubbing my back a certain way that irritates me. Every time he does that, I want to smack him, but I don't say anything, you know? So I'm like, how did you waste 25 years like this? Right? I mean, imagine he starts the foreplay by rubbing her back. She wants to slap him. Instead, she just kind of keeps her mouth shut and continues and kind of makes it work. That's what she told me. I just make it work. Why? So I told her, I give you permission to tell him, please do not rub my back the same way because I don't like it. He was so apologetic afterwards. And he said, you didn't tell me. Why didn't you tell me? So these empty conversation bubbles, right? When two people are kind of in a sexual situation, these thoughts are coming up, these thoughts are coming up. They just don't share it. So sexual communication is so important, especially after cancer treatment, because our bodies have changed. The same touch doesn't work anymore. And sometimes touch brings grief. My breast used to be so sensual before a cancer treatment, and now it feels numb. And every time you touch me, I feel, sad. I feel my sense of loss. This needs to be shared with your partner, because then it creates compassion in your partner. Oh, I'm so sorry. So what would feel better? Let me take your hand and I'll show you what feels better. So hand on hand touch. This feels better to me. So again, communication is the key to good sex. And this is true for everybody, even 20-year-olds. It's even worse with 20-year-olds because they don't talk, because they think they have it all. So they just are like going for it, but they also suffer because they're not communicating. I really think these are the three tips I want to emphasize. And I'm going to also include Priscilla's tip and Kevin's tip. Each one of them are great tips, and I would like you to remember them very, very well, especially the self-compassion and the scheduling. Without those two things, sex is not happening. So sex is much more than penile vaginal intercourse. Use a broader interpretation of sex because you will be better for it. And brain is your biggest sex organ, and we can use brains to, fantasize and supercharge our desires. And sexual communication with a partner about our likes and dislikes is a really, really good way to connect sexually with our partner. So I'm going to stop there and wait for questions.
Great. Love it. I do have to laugh about the back rubbing. I think it's so funny. I think probably all have experienced something like where you're like, oh no, that doesn't feel good. Yeah.
Yes. Yes.
It's so important. I want to add one more thing. I think of this because when you say our bodies are changing so much, and obviously I'm a 21-year survivor and bilateral mastectomy and went through it all, right? Went through it all and a very young woman. And I had to remember that I had to learn what felt good to me and practice on myself, which was different for me, right?
Mhm.
Like, I don't know if it's my generation or it was different. And being able to know what now feels good for me and then to teach my partner was so valuable, right? It just,
Yes.
there's something to be said about that where you can actually, experience and pleasure yourself so that you can then teach and learn that new normal, right? It's just,
I think that's a wonderful point, Sue, because there is a lot of people are very inhibited when they think about masturbation, self-pleasuring. You can call it, use any word you want.
yeah,
Um, that is a really good way, priming our bodies, learning about our bodies. How has our pleasuring changed after cancer treatment? It does change. It changes for women
yes.
after baby. It changes for men as well. I mean, all genders have, there are transitions to where our pleasurable areas, our erogenous zones are changes. And aging, menopause, andropause, during those times also there are changes to bodies. There's delays in ejaculation, delay in orgasm. So figuring out what our body can and cannot do is a great idea. Then you share it with your partner. You know what? This is what works for me. It takes me a little bit longer to orgasm. I want you to know that. That is part of sexual communication as well. Great point, Sue. Thank you.
Yeah. I know Angel was saying, like, what if you don't have a partner? That's
Even if you don't,
okay. You get at it, right? Like you do it for you. You do it for you, right? It's
absolutely.
so enjoyable.
Self-pleasuring is a gift to yourself.
Yeah. Yeah. For sure.
Self-pleasuring is a gift to yourself. There are so many benefits to it. First of all, it is really fun and you can add all kinds of stuff. Now there are so many toys, sex toys that are available. There are fantasy videos. You can watch videos and fantasize. and use sex toys and bring yourself to orgasm. It also, it reduces infections. It helps us build immunity. Or, masturbation and orgasms, there are studies that show that it actually increases our immunity. And it also lowers our stress level, and it helps us sleep. So there are so many benefits to it. So I would say, think about it as a gift to yourself.
Yeah, I love that. It's very
And,
good.
and it also helps increase desire, because self-pleasuring increases desire, because your body it's almost like it's lost its kind of its energy, and it's kind of waiting for you to kind of re-trigger the energy. We are all sexual beings. We are all capable of sexuality. So self-pleasuring is a great way to sort of prime the pump in some ways, to kind of increase our desire.
Yeah.
I think that really speaks to a lot of the questions that we're getting about low libido in general. So it sounds like that
Yes.
can kind of help encourage bringing back that libido. Am I hearing that correctly?
Absolutely. And, part of that is also fantasizing. Sexual fantasies are ours. We have that precious resource, right? In a minute, you can fantasize about whoever you want to fantasize, whatever you want to fantasize about. We've all watched so many Hollywood movies. We've all read so many trashy novels. There are so many fun scenes and episodes we can bring to our mind. So when you fantasize and you then, kind of self-pleasure, there you've created a great way to increase your desire. So this is why brain is the biggest sex organ, because that is the biggest gift we have.
No, I love that you
Amazing.
say that. And I feel like it's okay to practice. Like it might be awkward at first and it might not like, oh, this feels so not like me but then once you keep practicing, then all of a sudden you get into a groove and I love that Priscilla said it's self-care. It's self-care. It's just a
It's
different way of
absolutely
looking at it.
self-care.
Mm-hmm. Yeah.
It's
Yeah, for
definitely
sure.
self-care. And the thing about self-pleasuring is nobody's there to judge us.
Yeah.
So it also helps with what we call like insecurities when you're with a partner, that could be a little bit of anxiety
Yeah.
about sharing your pleasure with someone. But when you're self-pleasuring, you don't
Just
have to worry about pleasing anybody, only pleasing yourself. If you don't manage to have an orgasm, it's okay. You can go to sleep. You can try the next day.
absolutely. Dana, there is it's called Good Clean Love. It actually is in our care boxes. There's an estrogen-free lubricant. They have a moisturizer as well. So something that is very high on my list. Dr. Belia Friedman, you can share any other ones that you think of, but we know that we are big fans of this brand and they have both products.
I would also recommend Uberlube. It's very good. It's clean product, and a lot of
Great.
cancer survivors use it. It's called Uberlube. I'll put it in this chat. I'm sorry, I'm not reading the chat because
No, we got it for you. That's our job.
Yeah,
Aaron and I.
absolutely.
That's why
Yeah.
we're here,
And I also want to bring on Kevin and Priscilla because I do want to open up the floor for additional questions as well. But please feel free to continue to um, ping Sabitha. But we have all of our experts here tonight, so please feel free to put in the chat or raise your hand with additional questions as well. And we will pick their brains for as long as we have them.
Yeah. You're making me smile, Aaron, because sex takes over the conversation all the
Yeah.
time. All the
All
time,
the time.
right?
I know. That's why I'm trying to keep us on track. So I'm trying to,
I
but we could go
appreciate
down.
that.
Well,
Yeah.
and I will say one of the things that I also put in the chat, as in addition to the resources that Sabitha had mentioned, was a topic we also did on dating and cancer. So that was something that came up for those that may not be in a relationship, or those that are in their 20s or 30s with a diagnosis, and navigating that space, or even for those
Yeah.
that
That are older.
maybe in any
Absolutely.
situation and looking for a partner, having those conversations, when to bring how to navigate that space. So that was a really great segment as well to guide along that. So I popped that link in our chat also.
Yeah, I'm looking at our three guest speakers, and I feel like when they are all in synergy, when you're moving, when your mind is clear and a little bit lighter, and then, the sex will come too, right? Like it just, yeah, I just feel like it's the whole package, right? It's the whole, yeah, for
That's what I
sure.
was gonna say, Sue, if I
You want
can
banana?
interrupt really quickly.
You want banana?
Uh,
Okay, you can have it.
it's so cute. I'm hearing a
Need me
baby.
to open it?
Oh.
You can open it. It's yours. It's
Um,
mine.
can I say
It's yours.
something? Is that okay?
Yeah, go for it.
Okay.
Yep.
My very, very, very good girlfriend, closest friend, is about a year a year out of surgery for breast cancer, had bilateral, and is dating. And you're not going to tell her. I'm not going to tell her your name. I mean, I'm not going to tell you her name, so I can say this. She finally decided she wanted to have sex with someone. And she really, truly got there by exercising again and feeling good about herself. And I'm going to bring Kevin into this too, by being really patient with herself because she was like in a rush. She was divorced before her diagnosis, so she was ready, ready. You know what I mean? And I love this because what she found out from this guy that she eventually did have sex with was that he didn't care. Didn't care. Once you really talked about it and told him what she was worried about, and this is after a few dates of getting to know each other, he was like, I don't care. And I just was so happy that that happened for her because a lot of what she was worried about, she was creating in her own head.
Yes, that is very true. That's very true. And I do want to add, Priscilla, that exercise is a great way to become more sexual
Yeah.
because it increases blood flow to your to your body, to
Yeah.
your genital area. So it's a really great way to increase desire.
Yes.
This
We
was
had
gonna.
a,
I was gonna.
go ahead,
Sorry.
Ken.
No, I was just gonna add to that. I was like, this is why it's so important to have the self compassion. I know that for some it may be a lot of shame or guilt associated with not being able to have sex, or better yet, just not being able to pleasure oneself or their partner in the same way. So I would imagine that in the context of trying to find out, kind of getting back into the swing of things, it can take time. And I think that being patient, again, we live in kind of a society where like everything is supposed to be like
Right.
yesterday, right? So this is
No,
why it's
I
so
know.
important to take your time. And with mindfulness, that is all about intention. So if I have a focus and I focus on this one thing, it makes it easier for me to not bring in so many different kinds of distractions. And when I'm distracted, it's more difficult for me to focus on something like orgasming or being able to focus if one is self-pleasuring. But it is so important to have the ability to limit any distractions. I even sometimes encourage my clients to try their best to engage in digital detoxing, just to go away from devices and to just be present with your partner, or to be present with yourself, or to be present with whoever you're deciding to be with. But just more importantly, just being away from screens. This blue light does terrible things to our brains. But at the end of the day, it is so important to take your time to be present, to slow down, and allow yourself to be present and in the moment. So I think that's really important.
Great.
Priscilla, I see there's a question just about where to start.
Yeah.
What would you suggest as far as, how many pounds to lift? And I know that really is very, very personal to each
It
person.
is for sure. And I was just getting ready to type to you, Sheila. A general rule of thumb, because every body is different, is I wouldn't start with anything heavier than 3 pounds. And if it feels like you could do it for like 30 minutes, you might need to be going higher. But that's like Sue said, it's kind of hard to say based on your overall history with exercise, if you're really deeply deconditioned, if you have range of motion issues. So, you know, if you feel like you could repeatedly do biceps with a 3 pound weight and you're like, this is nothing, that means it's nothing. It means you need to go a little higher. But you never, when you're getting to the point where you feel like you can increase after you've done that for a while, you never want to jump more than 5 pounds. So if you're used to using 3 and you feel like, okay, I'm ready to go up, you don't go to 10, you go to 5, right? And then you kind of want to see how long you can do that. Ideally, I tell people if you can do 3 rounds of an exercise, 3 rounds of whatever reps, let's say 5 to 10 reps, that third round, you should be like, I can't stand this. You kind of want to be like, I want to be done with it. You don't want your first round to be like that, but you don't want it to be the opposite either, where you're like, this is ridiculous. I could do this all day. That
Great.
help?
Great.
Okay.
Yeah, that's great. And we had a clarifying question just about when someone wants to begin weight training, where do they get that clearance from? Is it their surgeon? Is it their medical oncologist, their GYN? Do you have a recommendation on who they might get the thumbs up from?
Oh, that's a great question. And I would say the person that you see the most, because I have to tell you, I've gotten, I've gotten clearances from people who, when I work with them, I'm like, what do you mean you have stenosis? Or what do you mean you have progression in your spine? Why are you getting cleared for no, no restrictions? So, the person that knows you the most, the person that you see the most, and if you have any doubts about what they have cleared you for, you need to talk to whoever you're working with about that. I mean, that's why it's good to have somebody trained, so that, if your doctor says you're okay, but you don't feel okay, you can express that and be met where you are. You don't want somebody being like, oh, well, then you're fine. I mean,
Hmm.
I hear it a lot in my community. I hear it a lot. I hear a lot of people saying, "Oh, I was told I have no restrictions, but I can't twist and I can't do forward folds." Oh, okay. So those are restrictions. Yeah.
Yeah. Mm. I love Kevin, I just love the patience. I'm reading some of the comments, and I remember having 2 toddlers and not being and working, and it's just like, just be gentle on yourself, right? Like, and then someone else said it's not a race. Like, she has to remind herself it's not a race. It is not a race. It's okay to have a pause. It's okay to have like a dry spell. It's okay to, maybe not do what you were hoping to do with all of this good advice, but guess what? There's always tomorrow, and you can try again. And you can always just try and be 1% better. I always talk about the 1%. I think it's so valuable. It's a coaching technique that you just, it's approachable, right? Like, you can do 1%. I can do 1% better today. I can do a little bit of what Priscilla's talking about. I'm just going to do a couple movements for 1 minute. And then the next day it might be 5 minutes, right? Like, it just starts building on itself, and it's something that doesn't feel so daunting. And I think we can apply that to almost every speaker tonight here. So thank you for the reminder of the patience, and it's not a race. And all of these providers, a lot of fans of yours, Priscilla, in the chat, well, they're all our members, right? Like, this is all available to you. Please get online, listen to our speakers, or watch Priscilla's videos, or actually get in on our one-on-one classes. And like, this is all here. This is a part of your next, right? Your survivorship program.
Yeah, I love that. And a lot of these, when we hear about the challenges with time, it makes me think of a recent segment we had, Sue, that talked about movement snacks. And so we had a topic and a speaker recently about fitness and movement regarding heart health. And she often tells her patients to do movement snacks, 10 minutes of movements. But I think we can apply that same thing to our mental health, meditation, taking a pause, 10-minute snacks, to a little bit of relationship, communication, 10-minute snacks, right? So I think sometimes when you're so overwhelmed with children and work and appointments and life and how you're feeling, the expectation we inadvertently put on ourselves is I have to do something for an hour or for this extended period of time, but maybe we have a snack of it. Maybe a snack is where we are right now. Can we move for a snack? Can we meditate for a snack? Can we just have some time with our partner or ourselves for a little snack? And that feels so much more approachable.
That's awesome.
Yeah,
That's a great point.
That's a great point.
I agree. 100%.
I'm scheduling my snacks.
I'm trying to think
Yeah.
about ways in which sex can be snacky. I'll think about that.
Mhm.
Yeah.
That could be fun.
Hmm.
Yeah. I love the whole, Kevin, it's always you again. It's always you again. Get outside. can I tell you, like when we have heavy days at work and just, we move fast at Unite for Her, right? And we're doing a great deal, and we just had a major fundraiser, and then 3 weeks before had another major fundraiser, and we move fast. Can I tell you what it feels like for me to get outside and see these leaves changing and feel the crisp air and just look at my backyard look different over the days? And it recharges me. It is such a recharge. So thank you for reminding everyone, because we're on screens a lot, right? I know we're on tonight because that's how we access this, but now you can turn it off, move on, right? Move on. Yeah. Erin, I gotta pop on another
Yep,
review podcast.
absolutely.
I'll leave
Yeah.
you, but thank you to all of our guests. You were incredible. Erin, if you wouldn't mind, if you could pop my email in the chat. If anyone here tonight would love their voice heard, we are actually doing interviews for our Giving Tuesday. I interview about 12 people during that day. It's always so lovely to hear the voices of our community, and we had so many great voices on tonight. I thought I'd put it out there. So if you want to be a part of just having a conversation with me, just like we're doing tonight, and want to be interviewed for Giving Tuesday for Unite for Her, please reach out. If you're in our area, you can even come to our office. We would love that. And Erin, thank you for putting my email in the chat.
You got it. You
All
got
right.
it.
Thank you so much.
Thanks, Sue.
Thanks, Erin.
And I will wrap us up for the evening. So I will remove our spotlights, but give a huge thanks to all of our expert panel tonight. So yes, we are putting together and coming to your inbox a recap of everything we learned today. So if you didn't get a chance to get a pen and paper handy, know that we will be sharing all of these so that you can have a reminder and just keep these tips with you as you move forward. It was really valid. It was great discussion. Thank you so much for the questions and the sharing. We appreciate all of you being here tonight. We've got so many more segments, so I'll just remind everyone again that we have our makeup and beauty segment happening tomorrow evening, Thursday, 6 p.m. Jolene Hart, our beauty advisor, with makeup artist Rebecca Kashana, will be teaching all of us how to have everyday makeup to make us feel confident. So please be sure to join us. We are asking that you submit your questions ahead of time. So just check that out online. And that'll be a fun segment. And then we've got a couple segments coming next week. Next week, I will plug our Cooking Methods 101 on Wednesday, the 19th at 5 p.m. And our dietitian team is setting your holiday table. So we're each making a holiday dish. So if you go to uniteforher.org/UFH Connect, you can sign up for all of our segments tomorrow nights as well as next week's. And if you follow us on social media or in our newsletter, all of it is available online. You can register for it. And then finally, I want to give one last thanks to our education sponsors. They continue to support to have amazing experts like our panel this evening. So our education events tonight are presented by West, Merck, Lilly, Novartis, and Gilead Sciences. We have additional support from our gold sponsors, Pfizer, GSK, and Daiichi Sankyo, and additional support from AbbVie, Tercera Therapeutics, and Veristem Oncology. So thank you all for being with us tonight. Thank you all to our amazing experts. We appreciate you and are so grateful for you being part of the Unite for Her community. I hope to see all of you again very soon. Have a great night and stay safe. Thanks, everyone.